how are you?
Hi, doctor. How are you?
I'm good, thank you. How have you been?
I'm all right.
Neurology is a lot of old school medicine where you really rely on the history and the examination of a patient. I'm Dr. Robin Massa, and I'm a neurologist at Mainline Health. My clinical focus is movement disorders, which include conditions where there's too much movement and conditions where there's too little movement. And this includes a broad range of conditions, including Parkinson's disease, tremors such as essential tremor, dystonia, Tourette's syndrome, ataxia, Huntington's disease. The symptoms of Parkinson's disease can be subtle at first. They start slow and gradually, and it's important that when you start to see these signs that they're not ignored and you speak to your doctor about them. It is helpful to meet with someone early on to help with that counseling and to help guide through that process. We do think that exercise is very important for a lot of neurologic disorders, including Parkinson's disease. And by starting medicines when it's appropriate, that can improve quality of life at that time and improve quality of life later down the road. When I meet with a patient, we spend a lot of time going through their history, their examination, any testing they had done, to try to get to a proper diagnosis. And I always make sure to explain to my patients why I've come to this conclusion with their diagnosis, what this means going forward, and what treatments I can offer to help them through this process. We might prescribe a medication or a treatment, and then we can see how that improves and how that really helps someone. It's an exciting field to be a part of. There have been new recent developments for patients with Parkinson's disease. There are some newer medications out that can help prolong the on time of the medication so that someone feels like they are moving well more consistently throughout the day. There are also some medications that are available that work very quickly, almost as rescue medications for when their regular medications wear off. There are new advances in deep brain stimulation so that we can better fine-tune the DBS. When I speak to my patients, I like to keep the conversation open and let them know that I'm available in between office visits. So if there's a change in a symptom or they have a question, they can always contact me in a message through the portal or through a phone call so that they know that they're not alone, and I am here for them if they need any help. When I see a patient and I prescribe a medication or a treatment that I think might be beneficial, and I say, go home, try this medication, and then they come back and they feel great. They feel like a new person, they are more functional, and I examine them, and objectively you can see tremor has decreased. They can walk better, and it's amazing to see these improvements.